The day is the 17th day of February 2025. Good afternoon and a warm welcome to KBC. Time to know what is shaping up the news conversation in the country at this hour. My name is Bentro Njue. My colleague on the sign language interpretation bit is Brian Muraru. Many thanks indeed for joining us. For comment you are watching us from, we are live on all our social media spaces, including our KBC digital app. We begin our live coverage from the Deputy President's residence. Had a health summit together with the Council of Governors, and they had a lot to talk about, also including the diminished funding from US aid. Let's first of all cross over to the Deputy President residence and have her here.
That is available beyond the is available for everyone who has registered. Number two, we are reviewing the means testing tool. The ministry will be giving us progress of where we are. In the next few days, we will have a new means testing tool to make sure that the tool is accurate, objective, and helps us leverage on all the fundamentals to make sure that we provide quality health care to the people of Kenya. That means testing tool will be informed by data, and there is integrate critical data to be used in the revised means testing tool, which has been revised following the feedback from members of the public and stakeholders that we have received over the 5 months. And therefore, going forward, we expect, once that process is complete, we expect a more energetic role. The targets of the UHC program is to make sure that every citizen of Kenya has a medical insurance cover. It is possible, and we are focused in making that possibility is realized in the shortest time possible. In terms of other interventions that have been made, especially with the financing of the program, I think there will be, at the end of the meeting, we'll be announcing the measures that the national government has taken through the supplementary budget, which will be presented before the National Assembly tomorrow, to make sure that some of the feedback we have received about financing.
That is Deputy President Professor earlier on while speaking at the health summit that has encompassed also the Council of Governors in regards to taking stock on the health situation in the country. Among what he has talked about is the collaboration county government, and especially in the wake of diminished US government funding after USAID froze some billions to take stock on what exactly they have been funding. Talking about 5 million Kenyans enrolled in SHA and also enjoying primary health care. My colleague Kamche Menza is currently on that beat in regards to what the Deputy President had to say, and now joins us with this report. Good afternoon, Kamche Menza. Kindly bring us up to speed.
Troy, like you said, we are coming to you live from the Deputy President's residence here in Nairobi, where that is the tent that is hosting the leadership in the healthcare system in the country. Of course, the Deputy President being the chief guest, leading the Council of Governors as well as the Ministry of Health in deliberating on some of the issues that are affecting the healthcare system. Remember, it is 5 months since the rollout of and there are a number of issues that have come up. So in his own words, the Deputy President said that this particular meeting is, of course, to upscale and firm up with regards or regarding the turbulence that has been witnessed in the delivery of various health hospitals or healthcare facilities. And in that particular brief that we've listened from the Deputy President, he has mentioned that 19.5 million Kenyans in the new healthcare system, that is the Social Health Authority or Taifa Care. But he said there are challenges still in the contributions. Not so many of them are doing the primary health care. He says all these who have registered are able to access it. But remember, this is not a meeting of the national government. The county governments are represented here. Of course, health is a devolved. Realize that many of the concerns or the challenges are being faced by the county governments. So what we have seen from the county governments, that is the chair of the Council of Governors, indicated a number of issues, including the issue of the implementation or services or services that are being taken back to the counties in terms of healthcare. To the devices that are used in the claims processing, and they said that the devices usually have a downtime in so many of the health facilities. So the issue there, those are some of the challenges for partners. What they are doing now is actually to highlight on some of the challenges, including the transition of services in the social health insurance. They indicate that 5,380 claims processing devices failure, and they were requesting for an expansion of those devices. The other issue was on the implementation of the capitation for the level 2 and level 3 health facilities. The issue on the HIF, the unpaid bills include roughly 7.5 billion that the county is saying if they are not settled, they continue to paralyze services at the county government. The primary health care fund also they indicate that they need to be fully implemented. There is an issue that even the Deputy President, as he did the opening remarks, talked about, that was with regards to the funding that comes from the donor or the development partners, or the rather Kenya or African countries mostly receive from the partners, including the US government funds that right now we understand, or as it was said over the United States, that they will be pulling down some of this funding, is that they're saying that there is going to be a big impact, of course, on the health system. But he said that they will not allow that particular reduction of funds to Kenya to affect the healthcare system. So that is an issue that as well the county government said has already started affecting. There was an indication here in terms of the over-reliance on donor funding that 11,000 healthcare workers that are being financed by the US government have been affected, as well as a disruption such as the one on the HIV. Now you will understand, or rather some of the statistics that we have received from the Ministry of Health is that 1.4 million Kenyans live with HIV on the antiretroviral medication. So those are some of the people that will be affected. Some of the interventions that they are seeking to have or be brought back include the continuity of that particular issues that the county government says need to be addressed by the national government. So right behind me, that is the tent that is hosting the leadership, of course, from the county governments as well as the national. The Ministry of Health also is available, or rather is also present in that particular meeting to try and address some of the challenges. Remember, it's only 5 months since SHA was rolled out, and they're saying that there's going to be a review of the means testing system, of course, to ensure that more people are being brought and they'll be using the data, or they're improving on the data. So basically, we are here. That is a closed door meeting. We are just waiting out here. Once the resolutions, and of course we'll be able to understand better on the way forward, as this is just a stock-taking meeting, the challenges facing the country or the healthcare system, as well as the way forward that the leadership will come out with once they're in studio.
Chair live from the Deputy President residence in Karen there. Remember, the health summit that is also encompassing the Council of Governors is currently under it down for us in regards to that, and especially the challenge that we have in regards to the 11,000 workers under the US funded programs and the 1.4 million Kenyans who require the HIV drugs. But no disruptions. They are working on a way to ensure that there will be no disruption in